When we talk about the diabetic foot, we always have to consider the diabetic ulcer and the diabetic wound or infection. These are avoidable in the great majority of cases with good diabetes education. You should definitely speak with your provider about how to examine your feet at home on a daily basis. I talk with my patients all the time and I tell them that diabetes is the one disease where the patient absolutely has control. You don't have to go on to develop a diabetic ulcer or a diabetic wound. They are avoidable with instruction, education, and care. However, when they do happen, they don't always have to lead to an amputation. The catastrophic end result can be avoided with good management, good infection control, and trying to see the provider before the end point really occurs. Most of the time, diabetic ulcers start as a callus, and the callus breaks down for a number of mechanical reasons, and that evolves into a diabetic ulcer. The problem is that in those cases, the patient or person doesn't have adequate feeling. They don't feel that there's a problem on their foot. That's where the diabetes education part of it comes in, because if you check your feet or examine your feet every day, then what's there today may not have been there yesterday. And in the worst case scenario, it's only been present for 24 hours. And so it doesn't have to lead to a catastrophic result. If you have an ulcer, if you have a wound, you should absolutely make an appointment to get in and see your provider as soon as possible. They are treatable, they are manageable, and in the majority of cases do not need to lead to an amputation.